Cancer has emerged as one of the leading healthcare challenges worldwide, and India is no exception. Over the past few decades, the country has witnessed a concerning rise in cancer cases, particularly among the young population. 4th of February is celebrated as World Cancer Day, and today we have with us Dr. Sanjay Dudhat, a renowned cancer surgeon from Mumbai, India, to shed light on this growing crisis. And let's delve into the reasons behind it, and let's ask Dr. Dudhat himself that. He's been practicing as a cancer surgeon over the last 30 years. He's also the crusader against cancer. Dr. Dudhat, welcome to my podcast.
Thank you so much, Mr. Mayank, for inviting me and contributing something to the viewers. Thank you. Thank you so much.
Thank you, Doctor. Cancer is the second leading cause of death, and if I may quote the WHO figures from 2018, it's about 1 in 6 death is caused by cancer. The burden is rising, and if we talk about the specifics in India, then what do you think? What are the contributing factors where the Indian prevalence of cancer is alarming and it's rising rapidly?
We know that there is a lack of cancer awareness all over the world and especially in the developing countries. So, cancer awareness at all parts of the countries, then early detection and its proper treatment that constitutes the aim of the World Cancer Day, basically. And how we can reduce the death with this, I think that is the main aim for the World Cancer Day. Early detection and reducing the death. That is how World Cancer Day has been celebrated. And every year there is a different theme. And this year we have a theme is basically United for Unique. That is how the theme for World Cancer Day this year. What it basically designates basically is a personalized cancer care. And what are the lacunae in that should be nullified.
Doctor, my question is, what about the prevalence in India? Because India,
Now,
in case
as
of
we see,
particularly in India, the prevalence is rising, the cases are
yeah,
rising. So, what could be the contributing factor as a cancer surgeon you are witnessing?
absolutely. A very right question for our Indian perspective. As we know that globally, as well as in India also, cancer is rising. We have got a burden of almost 16 to 18 lakhs new cases per year. And it's going to increase. And especially, we have got a little problem because we have got a young cancer patient incidences, which is rising quite badly in last 2 decades. Now, if you look at Western population, the young cancer patients between 15 to rather 20 to 45, the incidence is only 3 to 4%. But if you look at developing country like India, now it is almost more than 20%. It is too high. I mean, more than 20% is too high. Now, what are the factors behind it? Now we have got a large population. There is a lack of awareness of the disease itself. And the reasons are bad lifestyle. Now, lifestyle means smoking, tobacco, alcohol. Then bad dietary habits, which includes fast food, junk food, which includes some pesticides, which includes some other poisonous toxins which are not good for the body. Then tobacco, alcohol, as I said, they contribute together in a very high percentage. We have got almost 1/3 cases of cancers are because of tobacco and alcohol in India. Environmental pollution also acts as one of the major factors to increase this. Chemical pesticides exposure, as I said, delayed childbearing also will have the increase in the cancer incidence in young patients and genetic predisposition. Though it is 10% now, it is going to increase day by day because other environmental or these factors which I told you, they are going to act on the body as an external factors or internal factors, going to change the genetic situations, rather increasing the genetic mutations in the body and will increase the genetic mutation day by day, years by year. So these are the factors which contributes the young cancers. And why they are important? Because young cancers are considered to be aggressive biological behavior. Now, these cancer, if you don't detect early, the patients succumb to death. And that is why this awareness should be spread in the youngsters also, not only elderly, but youngsters also. They have been taught in the schools and the colleges to have an excellent lifestyle, how to reduce and how to detect also if there is something is there. So this is how the young breast cancer or young cancers prevalence in India.
Right, Doctor, as you rightly mentioned, the young cancers are very aggressive. I will come to that topic, but I have a few stats from the health ministry, and the stats says that there are about 14 lakh cases, that is 140,000 cases in 2020 in India, and they're expected to rise. As a cancer surgeon, any new trend that you are witnessing, any particular shift that you have noticed in the recent years?
So basically, especially if I make a mention, the breast cancer, which is very badly rising in a young patients population of India. You know, our young population is very high as compared to elderly, and this young population getting cancers right from age of 2021 to 45, the percentage is really high. And this trend we are seeing for last 2 decades, and slowly it is increasing day by day, years by years also. And that we need to properly address, because it is going to be a big challenge for the oncologists and the administrations, health administrators all over the country.
Right, doctor. I was coming to that point because young cancers are, I would say, very close to me, because my sister, when she was
Yes,
about 17, 18, she was diagnosed with cancer. She survived. But unfortunately, my cousin, she couldn't survive. She lost her life due to cancer. She was barely 26 and 27. I feel it necessary to talk about this young cancer, and especially cancer in women in India, as we all say that India is a youngest nation in the world, and we have 65% population less than 35 years of age. In this
correct.
context, could you explain to viewers that why is it so? Why is it important to discuss about young cancers?
Because since we have a large population of youngsters which are less than 40, and we know that overall lifestyle of the whole country is completely devastating, and it is not a right way by going through this lifestyle and reaching the healthier phase. So what we need to have is the changes in the lifestyle, and this is life. Cancer is a lifestyle disease, very clear about it. And if you look at 50 years before, lifestyle was so good, there were not much of cancer cases also. Now, if you look at after beyond 2000, these cases are increasing. Young cancers are increasing. If you look at in females, what cancers are increasing is breast, number one, in young patients, thyroid, head and neck cancer, especially oral cancers, tongue cancer, and lymphomas. These cancers are increasing in young population very, very rapidly. And I think we need to address this. We need to assess.
But sir, why these cancers are aggressive? Why especially young cancers are aggressive? I've spoken to you a lot of times about this, and you also say that yes, these are aggressive cancers. I want to know in very layman terms that why it happens that young cancers progress quite quickly.
If you look at, if you divide young cancers and elderly cancers beyond 50, uh, it is a straightforward finding that young cancer behavior is aggressive and old cancer, elderly cancer behavior is a slow growing disease. This is how the findings are. I think could be possible in younger patients when the cells are developing, cells are having the in the development, getting the brunt from the external factors or internal factors. I think that aggressive behavior must have come. And if you look at the case of cancer breast, if you take the example, we have got a triple negative cancers in breast cancer, because these triple negative cancers are very aggressive, and majority young cancers less than 40 45 are triple negative cancers, and always they have, majority times we are detecting genetic mutation BRCA1 and BRCA2. And if these BRCA1 and BRCA2 mutations are there, you need to screen the whole family with the sisters, daughters, then everybody you have to. So this is how the complicated things which are occurring in young cancer patients, and their treatment is also very long, almost 8 to 9 months. If you look at chemotherapy, surgery, where majority cases we have to give aggressive chemotherapy first, and then we have to do surgery, radiation therapy, and so called. Now, in such patients, we are adding immunotherapy also if they are very, very aggressive cancers in to start with also. So that will increase their disease-free survival, that will increase their overall survival. And this immunotherapy also to certain extent, they are showing good results in a recent studies.
Doctor, you mentioned about lifestyle. So, lifestyle, this term of lifestyle, it's also includes eating habits, and we all have been observing for last few years, especially younger population, their lifestyle has changed, their eating habits have changed. Even my eating habit has changed. I include me also in that younger generation. So, do you think this is the major contributing factor, the change or the shift in eating habits?
Absolutely. Very right questions. Because as we know that we are going towards fast food and junk food, easily available foods, not to do any much of a hard work for that. So that is been easily accepted. There is a glamour behind this all these foods. So that is also one of the reasons. So my friend is eating, other things are doing. Why not? I should do that. As we see in smoking and alcohol, the same thing is in this food. So all these factors, they come in diet. What is a standard diet? Is basically multiple standard good vegetables, fruits, everything good protein. That is called a standard diet. But we are forgetting that standard diet and coming to fast food and junk food, which doesn't give any nutritious diet testing. But despite of that, by having this bad food with the fat contents very high, we are leading to obesity. I think obesity is a major factor nowadays for cancer development. And especially there are almost 10 to 12 cancers are caused by the obesity, which was not the study before 20 years before. Now we are seeing if you take the almost 100 patients of breast cancer, normal breast and normal weight and 100 patients, 100 people of obese, the chances will increase by almost 20-25% towards obesity. So not only breast, kidney, colon, so-called, so many 10 to 12 cancers are caused by the obesity. I think obesity needs to be required big awareness and good dietary instructions right from school and colleges to all the children. And they should be bombarded on this because they are going to not only obesity, the odd contents, the adultery contents of the food going into the body are going to show the let's effect later on to their body. So that is why dietary habits are has to be proper. It's to be taught by the parents. It should be taught in the schools. It should be taught in the colleges all over. I think that how we do cancer awareness. So obesity awareness has to be and dietary awareness has to be done very aggressively all over the country.
Right, Doctor, you spoke and touched upon a very important topic of obesity, and my next question was on obesity specific, because I have a few data points here which I would like to mention. In the United States, as per CDC, the Center for Disease Control, there are
Correct.
more than 690,000 obesity associated cancers in 2021. And if I bifurcate as per CDC's data, 212,000 are men and about 480,000 are women. And there was one study which I recently read that about 40% of cancers are linked to obesity. Isn't it alarming?
100%. That is why I said, no, we have to be. Initially, we were not making why cancer incidence was increasing. See, we are looking at the factors of tobacco, alcohol, other things. But obesity factor came in last 2 decades, and we studied all over the world that how obesity is linked to the cancer. That is number one. Now, in females, basically, breast cancer is increasing, post-menopausal increasing obesity, increasing endometrial cancer as well as the ovarian cancers also. So all these cancers they are coming in a big way. So that is why this is very alarming. And as I said, we need to do good awareness regarding not to have obesity, have a healthy weight throughout your life. And that comes because what happens, we are eating, but we are not exercising. And that is why burning the calories is very important. Every day, 1 hour exercise, 1 hour yoga meditation, give 2 hours to your body. Scientifically, it will decrease the chance of almost 20-25% of cancers in your body. I think that is a big percentage, 20-25%. So looking at your body, rejuvenating your body and making the body healthy with healthy nutritious diet, I think it is a key for living long without chronic diseases.
Uh, Doctor, there's one important thing I would like to stress here. I know it's a controversial thing. doctor fraternity worldwide is saying that we should maintain a balanced diet. We should make sure that we should exercise,
Correct.
and we do all we do take all sort of precautions, I would say. But on the other hand, there were a couple of corporate statements that you need to work 80 hours and 90 hours.
Uh, I'm telling you. See, work has to have some systems also at the same time. You have to work according to your body capacity, because finally machines are also require servicing and rest. And if our body is constantly under stress, constantly doing this thing and not giving time for the exercises is not correct according to me. As a doctor also, as a surgeon also, I have given my example. After doing 14 to 15 hours of work, 6 o'clock I am in the gym. So that is how you have to maintain. You have to keep your body properly directed for this, and we have to see that out of 24 hours, 2 hours are should be given to the body, and good 6 to 7 hours of a good sleep in a 11 to 6 fashion. Of course, there are certain shifts which are there in the services I can do understand. But of course, this is called a change in the lifestyle. So everywhere the program should be done. How we should take care of our corporate people also. That corporate system has to see that how we are giving the burden and how they are going to, what is happening because of the only giving burden to the population who are working. They are under stress because they feel that I might lose the job if I don't do the work at that particular hours. And that is why the whole thing is there. And they leave everything. They don't look at their body. They don't look at the diet. They just go on working, working and working. And here is the crux where we are failing in preventing chronic disease, not only cancer, chronic diseases like diabetes, hypertension, so many are there. They are going to be in a younger age, which are happening, which is so bad. We are getting diabetes and hypertension patient also at the age of 25, 27, getting heart attacks at the age of 30, all because of stress as well as this wrong lifestyle.
You should listen to your body and give body its time to reheal. And I would say yoga, meditation, exercise, I think these are the things which helps body to heal. My next question is about there are a lot of advancement in cancer treatment. Now, other than chemotherapy, there are other advancement too. So, I think would you touch upon this important aspect, that what are the new advancement techniques we have to fight against cancer?
There are basic four treatments of cancer broadly: surgery, chemotherapy, targeted therapy, and others, radiation therapy, as well as hormonal therapy. To see the surgical point of view, it was a radical concept 30 years before. Now it has been changed to organ preservation surgery, because organ preservation is a big boon for all the patients. Who wants to remove the breast at a younger age? No, nobody wants it. So organ preservation is extremely good thing which has come up in last 30 years in the world, and that has been followed. 65% of breast cancer the patients we are preserving the breast. I think that is a big boon for the patient. That is what, not from for the breast point of view. We are preserving the kidneys. We are preserving other organs also wherever it is possible. Tongue, oral cancer. We are doing all sorts of conservative surgeries nowadays, which are absolutely oncological safe. Second thing, in chemotherapy, of course, in surgery, we have got robotics for prostate and other things. We have got a laparoscopy for very early cancers of uterus and other things, also colon. These developments are happening. Then secondly, in chemotherapy, apart from chemotherapy, we have got a targeted therapy which came in pictures in last 2 decades. Then we added immunotherapy to that. Now, initially, immunotherapy was only for metastatic or advanced cancers. Nowadays, like triple negative aggressive cancers, we are giving them an option of adding immunotherapy so that overall disease-free and survival will increase. So that immunotherapy also adding this thing, as well as there we are what we call it as a newer thing is the CAR T cell therapy. See, this CAR T cell therapy is basically, it is a chymeric antigen, what we call it as CAR T cell, and chymeric antigen receptor. So these T cells are being withdrawn from the body. They are in the lab. They are being modified in such a way that they can fight with the cancers, and they are again put it in the back to the body of the patients. Of course, this is an expensive procedure at present in the world. At present in India also it has come, but in future it is going to be work, because at present it's working for the leukemias, blood dyscrasias, and lymphomas, multiple myelomas too. But giving the initial good results indicate that we can do something much better and much advancement in the CAR T cell therapy also. In future, what is going to happen, man? I'm telling you, the whole chemotherapy, everything aspect is going to decrease, and they will find something else to treat the cancer, because chemotherapy is disliked by each and every person in the world. Nobody likes chemotherapy because of the side effects and everything. So in future, the treatments are going to be really different. I'm telling you, 30 years, 20 years down the line, if we sit together again, we are talking about completely different treatment with genetic transfers and everything. So we are going to have something different. Though the cancer incidence is going to be 60 to 70% increase by 2050 has been predicted by WHO. Even then, we have to be ready to fight with different weapons to fight against this cancer.
So,
Again, the radiation therapy, we have got excellent machines also. We have got a less side effect with greater efficacy. And hormonal tablets, we do have for certain cancers which are giving good relief as well as increasing disease-free survival too.
Dr. Dutt, I have an important question here. If somebody comes to you as a patient who's suffering from cancer or detected cancer at the early stage, they have a lot of misconceptions in their mind about cancer, about treatment, about, as you mentioned, organ removal or something. So what are those misconceptions which you talk to them and make sure that the misconceptions are not there and they have the clarity about it?
I'm working for almost more than 3 decades in this branch. So majority patients, they are still afraid of the word cancer, and which we would like to take it out from their mind that early detected cancers are absolutely curable. See, I always give example to my patients. If you had given a choice and you have to accept it, one is a treatable, curable cancer, and one is suppose paralysis for 10 years on the bed. Which will you prefer? They always prefer cancer. Now, this is how we need to change the psychology of the people. There are so n number of diseases apart from cancer. Why only cancer is to be given importance? I know it is increasing, but that fear has to come out of the mind of the people that cancer is very treatable even if it is detected, and it is preventable also if you do certain things. With all preventable aspects, if you see, we can prevent around 50 to 60% of cancer, which is a very large percentage. Now, again, what we talk about, exactly, what was your question?
Misconceptions about cancer. A lot of people have
So
misconceptions.
myth basically, cancer is contagious. So cancer is contagious. I'm seeing in the educated people also. But now, slowly, it has decreasing this myth, and people are knowing that cancer is not contagious at all. But initially, it was a very bad myth for the cancer point of view. Second thing, cancer is never curable. It is another myth. It is a death sentence. No. Early stage cancers are absolutely curable. I would suggest 100% curable. Third is, cancer treatments are miserable. No, not at all. Of course, they are not like a Cadbury chocolates. But if you explain them, counsel them, and treat them with a proper way, with treating the side effects as well as putting them in a good nutrition and hydration, majority side effects are being minimized and giving a better and better cure for the same. Then another myth, breast cancer occurs only in the females. Of course, it occurs in the males also, but the percentage is less, almost 1.2% now. Slowly it is increasing, very slowly, because same manipulations are occurring in the male hormones also at the same time. So we are seeing that cases also. So these are certain myths which are been commonly seen in the population.
Thank you so much, doctor, for your time. Appreciate you talking to me on this podcast, and I hope the viewers will surely get benefit out of it, and they'll listen to this podcast. So they'll get to know a lot of important things which you spoke about, organ preservation. That important. Second important thing is obesity related to cancer.
Thank you so much, Mayank, for inviting me and giving me an opportunity to talk to the viewers and giving something to the viewers on the day of World Cancer Day.